So today I'm going to walk you through the real warning signs that seniors and their family need to know. The ones that don't look like heart attack at all, because knowing these signs could literally be the difference between life and death. According to the CDC, someone in the United States has heart attack every 40 seconds, every single 40 seconds. And out of the roughly 805,000 heart attacks that happens in America every year, about 1 in 5 are completely silent, meaning the person has no idea it was happening. Now, who is most vulnerable? Seniors, people over 65, and the risk goes even higher if that senior has high blood pressure, diabetes, or high cholesterol. So why are older adults more at risk of silent heart attacks? It's because as we age, our nerve sensitivity changes. The pain signals that would normally scream emergency in a younger person become quieter, sometimes completely muted. Couple that with the fact that many seniors already live with chronic pain, fatigue, or digestive issues, and it becomes very easy to dismiss a heart attack just as one of those days. But here is what makes this truly dangerous. A silent heart attack still causes damages. Heart muscles is still dying, and if it goes undetected and untreated, the risk of stroke, heart failure, and a second, often more severe heart attack increases dramatically. Now, let's talk about what to actually look out for. Number one signs you should look out for is fatigue that doesn't make sense, not the kind of tiredness that goes away after a good night's sleep. I'm talking about an overwhelming, bone deep exhausting that shows up out of nowhere and doesn't improve with rest. Think about it this way. Imagine that pump is struggling. If its supply of blood and oxygen is being cut off, every single organ in your body start getting less fuel. Your muscle, your brain, and everything. The result is that your body feels like it's running on empty, even when you haven't done anything strenuous. So if your elderly parent, your grandparent suddenly finds everyday tasks like climbing staircase, cooking, folding laundries harder than usual, and they seem mentally foggy or unusually drained, please don't brush it off as aging. That is your signal to get them checked. So here is what you do. Don't wait. Book a cardiology appointment within days, not weeks. Repeat an ECG and a blood markers troponin levels, including troponin levels. Then the second sign you should look out for is shortness of breath that seems out of place. You don't have to be running a marathon to experience dangerous breathlessness. I've seen seniors who got wounded bending over to tie their shoes, and that was their heart waving the red flag. When the heart is weakened or under stress, it struggles to pump blood efficiently. The result is that even simple, low effort activities like carrying a light grocery bag, walking from the bedroom to the kitchen, or standing up quickly can leave a senior feeling breathless or dizzy. Most seniors also notice a tightness in their chest alongside with breathing difficulty. Others feel lightheaded, and others simply feel off like something is not right, but they can't put their finger on what. So this combination of breathlessness, dizziness, a vague sense of unease is a classic presentation of a silent heart event in older adults. So here is what to do. If a senior consistently gets wounded during activities that previously handled with ease, that warrant an urgent medical evaluation, not let's see how it goes in a few days. And if you are finding this information valuable, I want you to hit that subscribe button right now. Every week on this channel, I break down complex medical topics into clear, practical information because understanding how your body is the first step to protecting it. So subscribe and make sure you never miss an episode that could save your life or someone you love. Then the third sign is pain in places you never expect. This is the one that catches most people completely off guard and is the one that gets dismissed the most. The senior complains of a jaw pain and they go see a dentist, they have a shoulder ache and they assume it's from sleeping awkwardly. And they blame an upper back tension on the old mattress. When you experience a left arm discomfort, they say, I probably lifted something wrong. But here is the medical reality. The heart and many other body regions share nerve pathways. When a heart is in distress, the pain signal travels along this shared route and show far from the chest. This is called referred pain. The most common reported non-chest location in silent heart attack in most seniors are the jaw, often mimicking a toothache, the left shoulder, the arm, the upper back, and the neck. The key distinguishing feature is that these pains often come and go. They appear without any obvious physical cause and may be accompanied by an unexplained fatigue or breathlessness we just discussed. So if a senior reports persistent unexplained pain in any of these areas, especially if it comes and goes with unclear cause, share that observation with their energy levels and breathing patterns. If multiple signs line up, seek emergency evaluation immediately. The number four sign is nausea, indigestion, or sudden dizziness. When the heart is under stress, it can trigger the vagus nerve, the nerve that connects the heart directly to the digestive system. Now, the result can be nausea, a feeling of fullness, mild indigestion, or even vomiting. This look exactly like something they ate disagree with them. Sudden lightheadedness or a feeling fainting, especially when standing up quickly, is also a red flag. So a struggling heart may not be pumping enough blood to the brain during postural changes, causing that sudden head rush that passes quickly but signals something deeper. If a senior experiences a sudden dizziness or a nausea that is not after a meal, not after a medication, or not tied to any explainable cause, especially if it is paired with mild chest discomfort or fatigue, treat it as heart emergency until proven otherwise. Do not give antacid or hope for the best. Call the medical help. Time matters enormously with heart attacks. If every minute without treatment is more heart muscle lost. Researchers found that many seniors who appear fine on routine risk assessment were actually walking around with dangerous silent plaque build up in their arteries and no one knew. So here is my practical recommendation for seniors and their families. If you are over 60 or over 45 with diabetes or heart block or high blood pressure, ask your doctor specifically about a CAC scan at your next visit. It is non-invasive, relatively affordable, and could reveal risk that standard blood tests and symptoms report miss entirely. This is a kind of proactive steps that genuinely save lives. This is what you can do to prevent this whole thing from happening. Here is what I want you to walk away with. Don't dismiss unusual fatigue, breathlessness, or vague discomfort as just aging. Your body is trying to communicate to you. So listen to it. Watch for patterns. One bad day may mean nothing, but a week of increasing tiredness, reduced activity, tolerance, or repeated unexplained symptoms is a pattern worth investigating urgently. Here are some practical steps to lower risk. Number one, maintain blood pressure below 130/80 through diet, exercise, and medications if prescribed. Then number two, keep your blood sugar controlled. Diabetes is one of the leading factors that silences heart attack symptoms. Then number three, get an annual ECG after age of 65, even if you feel fine. Then number four, ask your doctor about a coronary calcium score scan, which is CAC scan. Then number five is that you need to quit smoking. It accelerates arterial plaque builds up significantly. And also stay active with moderate daily movement. Even 20 minutes walk makes a measurable difference to heart health. Then number seven is that you need to manage stress actively. Chronic stress elevates cortisol, which damages arterial walls over time. So share this video with an elderly patient or a grandparent or a neighbor. You genuinely don't know whose life it might save. I am Dr. Emmanuel Bale, and this channel exists because I believe that an informed patient is a protected patient. And I will see you in the next video. Stay well and stay smart. Thank you.